Professor Morgub sent me a WhatsApp message, and I read the top line. It was mental health of health workers. And he said, I want oncology colleagues to be there. I said, fine, sure. I forwarded to Professor Nazir. I said, circulate it. Next day he calls me, Dr. Sahib, Toshuna Pagha lecture. Which lecture? He said, no, that's not the deal. But I can't say no to him. I have a lot of regard for him, a lot of respect for him. How many of you understand what is burnout? To be honest, I didn't. JCO had a lot of articles, burnout, burnout, burnout. I would never read them. What my understanding of burnout was, to be honest, I'm being precise, that was that an oncologist becomes an oncologist, learns and becomes a candle or a diya, tsung, and then burns out. That means he finishes his knowledge and eventually stops being productive. So I thought, okay, well, I'm not burning out. No, I didn't see this happens in West because they drink a lot and they're busy, so they lose track of the topic. But then, when some incident took place, I decided to understand what's burnout. So this was how it was defined in 1974 by Herbert Freudenberger. He said it's a state of fatigue, exhaustion, frustration. The reason for all this is professional activity, the result that fails to produce the expected expectations. So this is true for anybody. So when somebody gets exhaustion, fatigue, frustration, and you're not able to do your job, they call it burnout. In simpler terms, when work coupled with additional life pressures exceed the ability to cope, causing physical and mental distress. This is very simple. But then in 1981, there's a very elaborate explanation of burnout syndrome. Christina Maslach and Jackson, they gave a beautiful inventory, and it is on net. You look at it, there are huge questionnaires. You tick yes, no, then you know whether you have it or you don't have it. But basically, there are three dimensions which you look at. Emotional exhaustion, depersonalization or cynicism, and reduced personal achievement. Remember these three things. It's not uncommon. This is Medscape 2019 survey. It varies in different oncological specialties from 25 to 38%. 14% of these individuals get suicidal thoughts and 1% of them attempt suicide. Worst thing is that 64% never seek medical advice because they don't believe they have the problem. They don't understand the problem. One doctor in the United States of America kills him or herself daily because of burnout, and this is a fact. This is Crystal Caseta. She was the senior breast cancer medical oncologist in Mount Sinai Hospital. She was chief of infusion service. She killed her daughter and then herself. And this was the extreme burnout. Now, this is my story. My oncology career started here in PGI. 4 decades ago, I was in internal medicine. I got interested in cancer care because of a gentleman who had come from Hammersmith, Professor Deodar, and we treated lymphoma, leukemia. And then I traveled 4 continents, and I have evolved over 4 phases. I won't tell you the details. During this time, a lot of things happened in cancer care, but it was very great as far as advancement of cancer is concerned. President Nixon, on 23rd December 1971, signed a declaration called War on Cancer and allocated $1.5 billion, which is approximately $10 to $15 of today, to establish the National Cancer Institution. And that was a revolution in cancer treatment. With all this background, we here in Kashmir are a part of countries with limited resources. How do you put all these advancements which you read every day in journals, your books, articles, media, and then put it into practice to this person, to this person, and to this person, and to this person. And it's the person who doesn't even have clothes to wear. That's why we thought of choosing wisely. And Kashmir Oncology Forum, in one of its newsletters, published a Choosing Wisely Kashmir as how we can tailor-make these advancements for our place. Then we are faced with other problem. Superlatives in cancer research. Now every day you will see there's a game changer, a breakthrough, a grand breaking miracle, a revolutionary cure. But the patient comes to you, sir, I read yesterday, there's a game changer, this is a miraculous drug, why don't you give it to me? Oh, this is a novel type of surgery, they do it. Robotic surgery for removing a mole. Yes, of course, we can do that. Because it is groundbreaking. This is another thing which always goes in our brain. Now, this is not for the consumption of public, this is for the consumption of doctors. Look at it carefully. I started my career somewhere here. I would have shown you the kind of research we used to do there. I don't want to waste your time. This is industry funding of research. Do you see this line? Young boys and girls, do you see this line? It was 0. Today, 90% of cancer research is funded by industry. When we started cancer treatment, we had no industry. I remember we used to do research. The only funding we used to get was a drug. I remember a medicine which we got. They said it is GM8. And we started doing phase 1 trials in Edinburgh on that. Then we came to know it was carboplatin. This is all what we got a drug and we had to work on it. There was no other aid. We didn't even get a typist. Today everything is done by the industry. They fund millions of dollars for doing these trials. As a result, you see, this is the medical literature share of industry-funded literature about cancer research. And majority of these are not written by professors. I have written all my articles myself. I would write them, tear them, type them, tear them, and nowadays Pakiza types them, corrects them, and she gets fed up, and we were able to write 4 pages and barely published one article on quality of care of prostate cancer here, and it was headache. Who writes the papers now? Medical writers, not doctors. They may be doctors, but they are not the ones who did the research. They don't know what was done. But there is one single conclusion which, as oncologists, we appreciate the most. All medical research conducted all over the world has concluded that 100% of all Americans will eventually die. So will we. That's a fact. And to make death less painful, we started the palliative care, and why am I telling you this? I got very keenly involved in palliative care. Very keenly. Got doctors trained, nurses trained in Kerala, started this center. Masuda ji is here, she knows how we did it, what we were trying to do, caregiver support. And even the first EPIC, end of life program with Professor Tanveer Mir and Dr. Majid from JVC, and there were some more young Dr. Zad, psychiatrists who participated in this, trying to tell our youngsters how to deal with death and what to say and what not to say, how to make it comfortable, what drugs to use. And we would always believe death is inevitable, but pain is not. Pain can be controlled. With all that background, now I am a human being standing here over a period of time, working where? In Kashmir. Despite the fact that we as oncologists do not get too much involved, we don't ask the patient, okay, how much money you have in the pocket, did you eat dinner yesterday, what does your wife do, is your daughter married? We don't ask these many questions. We have a kind of barrier, we have an emotional distance. Patient cries, we don't cry all the time. Sometimes we do, but not all the time. We try to relieve the patient's misery by looking strong. Despite that, we do get involved gradually, especially when you have long-term involvement of patients. Remember, Kashmir is a very closed community. And when you have a solo practice like I have, you give continuum of care from diagnosis to death. And every patient is either a relative, a friend, a relative's friend, or a friend of a relative. And there were two major traumatic experiences. August 2019, we lost contact with our families, with our patients. We lost many patients. Many patients didn't get their painkiller medications. And many of them, I even today don't know what happened to them because there's no contact with them. And then immediately after, COVID-19. So there was a protracted period of about 6, 7, or almost a year, or maybe more, when everything was topsy-turvy. I started getting upset. Upset in real terms. Upset about myself. I started asking myself a question every day and every night. All my patients die. What the hell am I doing? Am I doing anything at all? What is the use of putting so much effort, so much time, so much torture, and they eventually die? As somebody, when I came in 1987, I had the first program on Radio Kashmir. There was one Mr. Shahryar. I still remember him. I don't know if he is alive. Say my salams to him. He said, Dr. Sahib, he introduced me. Yuthes Kashir Mazkan Cancer Now Shu Bozan Zanghas Chen Natan. These were, I still remember these words. Na su insan maran, ya shu gar maran, ya shu mal maran, ya shu gaw maran. So shu jun ti gasan, mal ti gasan. Ya mal ti gasan, jun ti gasan. This started blasting in my mind, Shahryar. And interestingly, whenever my patients got, they say, Dr. Sahib, Allah Ta'ala Deen has hurt us. And you know what I would tell them? Kya shu doi bat karan. Paradigar se mage chut gaye. They would look at me, but they would walk out. When it got so disturbing, I went to my father. Many of you know him, Dr. Ethikula at Sopor, who in my mind is a legend. He has had practice of medicine for maybe 60 years. I sat with him. I told him, Abajan, what am I doing? He said, why? I said, I'm doing nothing. Excuse me. I said, all what I have learned in my life so far, all what I have tried to learn is of no avail. These young boys, these young girls, these men, these women, they just slipped out of my hands and I am able to do nothing. He looked at me, he calls me Salim. He said, it is the same story of medicine in every generation. When I was a young man, I used to lose patients to cholera. They would die in front of my eyes, to typhoid, to TB, to simple infectious diseases. This is a replacement. You are doing the best you can. Eventually, he is the one who heals. It was a bit reassuring. Then it became deeper and deeper, and I would always start thinking like this. At that time, I decided to leave. I went to my son to America. I was in Buffalo with him, and believe me, within a week of my arrival there, I was a different man. There is a big park there, Delaware Park. I started going with my granddaughter, with my wife. We laughed. I went to eat a steak. We went zoo and museum till the final straw fell. I received a phone call at the middle of the night from Kashmir. A patient of mine, a relative, a friend, and my doctor. And I was treating her with a curative intent. And the person was in remission. And I am told that they have detected liver metastasis, lymph node metastasis. She is in agony. That was it. I stayed in Buffalo for one more week. I don't think I ever smiled, I ever laughed, I ever left. And I returned. The camel's back had broken. I felt worthless. My staff, they got frustrated. I would scream and shout at them. Even slightest alteration in normal I couldn't tolerate. I barely spoke to my family. I would go eat my food, pray, go to mosque, read Quran and sleep. This gave me a feeling that I have become very pious. Sata Khuda dostu bansi namaz, Quran, and to do nothing else. And I thought that because I am so God-fearing, Allah has taken me very close to Him. The only thing which I was thinking is, okay, now how can I end this misery? What am I doing on the face of this earth? Why am I on top of it? And then I started planning. I was thinking of the methods I will use. I will not disclose those methods to you. The place I will choose. The time I will choose. Every time I was saying, the only thing which stopped me was that it is a sin. Anyone who takes the life of a mu'min muta'ammidan, فَجَزَاؤُهُ جَهَنَّمْ. And I would back off. A step forward, a step back. A step forward, a step back. But then this became such a serious struggle that then I started getting a little closer and closer and closer, and I decided a date. When I decided a date, my son Usman called me. He said, I'm coming to Kashmir. I said, oh God. Now he's coming here after 5 years, so let me postpone it by 2-3 days more. Exactly, I'm telling you what happened. I postponed it. I said, okay, well, what I will do is, I will do it when he lands, so that he participates in my funeral. I want him to read my janazah. Then I said, oh God, suppose his flight gets delayed, he doesn't travel. So let me first confirmation that he has landed. When he landed, he called. I said, okay, let me give him one final embrace. Then I will go. So I waited for him to come. He came. In the evening, my elder son confronted me arrogantly. He said, aren't you happy that your son has come back after 5 years? Because I had no happiness. I didn't know what is happiness. I had forgotten what is happiness. I just looked at him. He said, what's your problem? I said, I can't tell you, I don't know. I don't know what's my problem. I am closer to my younger son emotionally. So I told him, let's go together to Sopore. He sat with me in my car. We sat at the back seat of my car. And I told him everything what had happened till now. He looked at me. He just said one word. Daddy, you have burnout. No sooner had he said this word burnout, I became normal. Instantaneously. Instantaneously. I'm telling you as if somebody put a switch off. I realized, yes, this is true. This is what I have. There's a very thin line between what we are palliating and between what we are killing with toxicity. And we have a very limited ability, according to Westerners, to prolong life. We cannot prolong life. Life is in the hands of Allah subhanahu wa ta'ala. We have to keep pace at very rapid scientific advances, which I showed you. They are at jets with light speed. And there's an existential question every day. Every day. These are the risk factors. And this is my personal experience I am sharing with you. Increasing work hours, increasing patient contact, increasing clerical burden. I don't know if you know, Zuhur knows, Azhar knows, we document everything in detail. I document even the size of the lymph nodes in the body. I measure them with a caliper. I measure the x-rays. It's a clerical burden. Now Dr. Roof is doing most of it for me, but still I have to dictate it to him. And time pressure. I don't have problem of autonomy, but you saw the stressful professional event which I had. And I know now that was the reason. And of course, country of practice. it has a tremendous impact on you. These are the signs of symptom burnout. I thought everything can be, if you are getting headache, you have burnout. Remember, if you have abdominal pain, you have burnout. If you have indigestion, you have burnout. If you have insomnia, you have burnout. If you have itching, you have burnout. Anything abnormal, you have burnout. Look at it. I mean, if you are dissatisfied with the life's balance, you have burnout. If you don't like your clothes, you have burnout. If you don't like the food your mother cooks, you have burnout. Everything is because of burnout. Assess it. I live it today, enjoying the news of my server. Just a few weeks before, one of my young females called me from Kulgam. Salim sahab, theek chu kas मैं आज करो खानदार में मुबारक मैं आज ये बचे मैं alhamdulillah. She had received chemotherapy, radiotherapy, and she became pregnant. She gave birth to a baby. What better news? And at the same time, I cherish those who are not today here to make this phone call to me. I remember them. I pray for them. And I believe you should never give up. Thank you very much for your attention.
I'm really speechless for one reason. Most of the times we look for our solutions in the textbooks, protocols, and they are all alien. I wish that Zad and Majid were here. Yesterday they said, sir, now you are not available to us. You have longitudinal studies, what is happening. Please give us access to that data you are not publishing. But my priority is community. We are only catering to 6% of people who are suffering from depression or anxiety. But we have trauma-related disorders. Yesterday, that's why I said that I don't go in national conferences now. We had social psychiatric conference here. And Majid being so dear, just like a son, that is, he was in tears yesterday because he remembered my wife and told people that were relations. But now I will first come to my personal experience. Obviously your spouse is your backbone, but I was doing every community work and other things. Because of my spouse, she would spare time and doing all other things. All of a sudden, she is diagnosed with stage 4 small cell carcinoma. I call Professor Shad Salim sahab. He says, you come immediately. When I go to him with the report, he sees it thoroughly and then tells me that there is a possibility this could be something really sinister or this could be something which is treatable, relatively lymphoma, something like that. But this is not possible to tell it clinically with clinical impression. Obviously, this is something I thought that everything has now collapsed. Before him, I was now a different person. But immediately what I remembered was that Prophet ﷺ had to face this. Dr. Salim Saab told me, he said, look here, you have been looking after thousands of Kashmiris for grief, bereavement, and now it's your turn. I told him, no worry. No worry, sir. But please tell me, can you manage her pain? Because he had bone metastasis. This is something which we say about with mind. So he told me this. I said, same thing, I repeated. He would tell you that is not the problem. I go back. My wife is waiting, she knowing that what it is. We went back and obviously my daughter was there. She was waiting because her husband had told her that everything is not okay. She's a little anxious type of person. So every time she would ask, she said, everything is not okay. So obviously, she was sobbing in there. So he, Fayaz and myself went upstairs there. And you can yourself imagine, it was something which would daze you, which would keep you in a state where you are not really in touch with the surroundings. After 5 or 10 minutes, our domestic help girl comes up and says that, Baji says, your lunch is ready, it's getting late, why don't you come down? After 5 minutes she comes up and she tells you, obviously she sees our state, she tells you, oh, I was thinking that we are Muslims here around me. Oh, I'm really dejected. Get down and have your lunch. So she forced us, we came down, and then she tells me that this is one patient. What about the patients who are waiting there for you? You know, this is same distress. If you are distressed on my account, go and see them. Same day I go to clinic, Monis is here, there are about 20, 25. You can see my state of mind and how that was balanced, because that is the ultimate source of healing and support that is available to us. Again, getting sort of, Prophet Sallallahu Alaihi Wasallam's life, I said, in comparison to that, this is nothing. So I go back. After that, Dr. Shad Sahib would tell you, till her last day, she had written actually with her own hand, पूरे कद से मैं खड़ी हूँ ये करम है तेरा, मुझको झुकने नहीं देता है सहारा तेरा. Till last she was coping. I have obviously my friends who are at different places in the country. Once they came to know about it, everybody expected I would be suicidal, I would be depressed, and my wife would be in a state of extreme depression. But Professor Shad Sahib would tell you that in spite of having lot of burden of metastatic, that kind of a malignancy, she would always cope that it's from Allah. This is just a temporary world. She would take care of our psychological needs. We are talking here about all these coping mechanisms because we believe in it and we do it. So to effectively combat stress, we need to activate body's natural relaxation responses. You can do this by relaxation techniques such as deep breathing, meditation, rhythmic exercises, fitting these activities into a routine. But this is actually what our deen tells us to strictly follow actually this prayer time, not to leave it, so that everything falls in place and you can practice that. It has its own benefits that we know. I'll not go into those details, but the relaxation response when activated will slow down our heart rate, breathing becomes slower and deeper, blood pressure drops, muscles relax, blood flow to the brain increases. One of the techniques that I mentioned here is visualization, where you relive through some past experiences which has been really refreshing and have given you a lot of pleasure, be it with your family, you have visited a place. Earlier I would advise people here, my people, that since there are gardens, there are crackdowns, please imagine a magic carpet just waiting in your lawn. Sit on this with your family and go to Pahalgam, and where you have lived previously or whatever it is. So something like that. It is all sensory kind of, if you see sun, I have put just an example, then smelling, what do you find where you are relaxing. But stress, we know, is a state where response to experiences that cause physical, emotional, and psychological challenges are actually disrupted. There is good stress and bad stress, which we know. Good would be some where we feel that, okay, we are mobilizing our resources to face a situation and overcome it and move to the next. Whereas chronic kind of a stress or something which is really beyond our capacity to handle, or is a perpetual kind of which every Kashmiri has been facing for such a long period. I will not talk about grief. I have just edited one Frontiers of Psychiatry journal as editor, ICD 11, WHO, as well as the American DSM 5 has included prolonged grief disorder. I wish that they had ever visited our place and then they would see 20 years, 30 years after that, the people are carrying with the grief. I wish that subsequently we discuss what is the difference between burnout, where simply no drugs, nothing, but everything reverts back. But the symptoms are same in depression. In depression also you kill yourself, the real problem. But if we just discuss in one session what are the differences, we would be empowering ourselves as well as patients. So we know what happens when stress is there. I said about acute, but about burnout. I have 2 papers. That's why I didn't put even a slide. This is our latest. This is an American Journal of Disasters we have published. But you would see one thing. You would get a copy. And the importance of data now. I examined almost all the doctors that time, faculty, SIKIMS, medical college, and Maslow's scale was used extensively in all those cases. And you found that burnout was relatively much lesser than what is it now, and it was in juniors, a few juniors only. But this time, what is concerning is that almost 50% of our health care givers have burnout. So, what Shad Saab said, I wish with his permission we could disseminate firstly to mental health professionals that if this is the state of affairs, that 50% of these healthcare providers have this, they would never tell you. And you need to go to them and you need to learn yourself first. So I have not put long details, you can just go through it.
I have known Professor Shad Salim for so many years as a colleague, as one of the most famous oncophysicians of Kashmir. But this was 2018 that in connection with one of my closest relatives who unfortunately had stage 4 malignancy small cell carcinoma without any symptoms, I happened to see him as a caregiver, and I noticed that keeping in view his all empathy, involvement with his patients, their families, I could see that he was in a phase of burnout, in adaptation phase, where I could see that he was working at a higher level of functioning, and non-verbally you could feel exhaustion also getting reflected, but obviously one would not convey it without being asked for it. I also subsequently saw him on few visits, but then 2019, when for about 6 months there was lockdown, curfew, which put cancer patients to a lot of distress, and obviously the ultimate healer of hundreds of such patients had to bear the brunt of such environment and circumstances. So these trying times had precipitated full-blown burnout in Professor Shad. When I saw him after an interval of 3 years, we can see that he has carried on with this physical and emotional exhaustion, cynicism, and also a feeling of ineffectiveness internally, not revealing to anybody, and that had led to ultimate exhaustion and burnout. Thankfully, just an interactive session collectively with the whole family, we could put things in place, and from extreme self-directed anger or intentions of harm got transformed into a lively, smiling, radiating the same reassurance and warmth for his near and dear ones, as well as for hundreds of patients looking to him as the ultimate Masiha for them.
Traumatic stress, which we know. Kashmir is We have already documented our sufferings. PTSD. Yesterday I quoted one example because PTSD has come from Vietnam. This is actually 68,000 Americans died there while bombing. Those 2 million people died. Vietnamese died. They were civilians, and more than 1 million combatants died. This was 2013. Coincidence, I was chairing a session over there, and the director of their medical education and mental health was presenting their profile. I asked her, this is yesterday also I told people, I asked her, depression is there, anxiety is there, adjustment related disorders are there. Where is PTSD? It has originated from this place. It was 00. She said, no, not sure. Just 2 years after that, British Journal of Psychiatry published an article where they say that 10% of Vietnamese have PTSD, highest, following a flood. They had compared it with Sri Lanka. They had also avoided their quota of trauma and whatnot. It was only 2.5%. What was it? Cumulative stress, but nobody had documented. So that way I have my satisfaction. This is actually with veteran affairs. Our first in literature, Magar so soon Gudrun. People tell me that how have you done it? That was a need, because I was finding some people suicidal in the family, some people very resilient, taking care of others, following a similar event. So this was something, a big challenge, and we studied genes, genetic profiling, and we found something, and that was published in an American journal, and that has come in guidelines. Another thing that has come first time in the world literature, our sufferings. That is, I would find that girls and boys would be tortured, what was happening. Even adult males would come to me for abuse and whatnot, and then they would be suicidal, and I would many times feel, is there any possible going all through these books, going outside and asking those? Because Katrina, when their people die, they are very serious about it. After tsunami, the whole concept changed of trauma, and because there more than 2,000 people died. But there was nothing beyond that which could help me. So Dr. Rafiq Pampuri, his student, who is actually now head of that one, I had done a research with them, because some people get, lump in the throat feeling. I treated them with an SSRI, with an antidepressant. So Rafiq Saab said, this is something which is dramatic. So it was, I took actually advantage of that connection and asked him that on Thursdays, those days we used to give all those shocks, real shocks. बेचारे की हड्डियाँ टूटती थी. So it was direct method. It was almost inhuman, but that was the facility you had. But when I would see somebody, a girl who is in a professional college, but she is so annoyed with her parents that they couldn't protect her from sexual abuse through somebody so it is really severe depression and PTSD. Similar cases. I thought with myself, this is not unethical, because those days post-traumatic stress disorder was included in anxiety disorder. So you don't give, it is only in severe depression. I started doing it after everything failed. So that is actually another study that has come in protocols, and that has originated from. That's our suffering. Anyway, I don't need to go into details. These are the studies this was the program actually that was just held here for you. This is long-term disasters and other things, but I think all these topics are incomplete without your actually inputs, guidance to people as such, because we are not just one unit. When we have peculiar problems, there have to be peculiar solutions. Say in oncology, the solutions will come from you, what needs to be done. This is only, you get excited for reappraising actually what this man was saying, pre-performance anxiety. There are studies which have shown that if you are able to only change your mind, your response changes. Harvard study would tell us that 30% of people had, in fact, increased mortality following severe stress. if they believed that stress is something which is disabling, while as the other group who believed that stress is enhancing, they didn't have any effect. So just coming to that, I will not go into the details. This they call rethink stress. This is the latest thing. What exactly Professor Shad Salim described? What was it? What changed? It changed here only. And you had, so that is actually our belief, but we are not actually working on that. We are working in some other area. I mean, our profession, psychiatry, while as the solution is somewhere else. Another thing then I will add it. That is, we are connecting today. So that way also this is actually something which is actually a good beginning, because this is the latest study that has shown that one of the most underappreciated aspects of stress response is stress makes you social. To understand this side of stress, we need to talk about a hormone, oxytocin. Normally we know about its very limited kind of, just this is also known as hug or cuddle hormone, but this is a very small part of it. The latest few studies have shown that this is a stress hormone. Stress hormone simultaneously, when you secrete norepinephrine, your heart starts, and all other effects, cortisol, but here is what Almighty Allah has put there as a check. This is anti-inflammatory. And now again, when empathy you say, there are receptors in your heart for oxytocin, and when oxytocin is released, the stress response, it is motivating you to seek support. So you don't withdraw. So if a little bit, once you change it here, oxytocin starts coming out once you are with your son, with whom he had an equation, and just a little bit of that type of a connection, a little bit of oxytocin, and obviously Shad Sahib was back, he bounced back into a state of without even a single pill, where he was at an extreme kind of a situation. So your biological stress response is nudging you to tell someone how you feel, instead of bottling it up. And your stress response wants to make sure you notice when someone else in your life is struggling, so that you can support each other. This is actually the hormone that I talked about. When you are in a state where you feel that everything is gone, now this is doomsday, your vessels get constricted and you get all the complications. On the opposite, it doesn't happen, rather they get dilated, you get motivated to work, so that is the effect. So stress makes us how you think and how you act. This is the last slide. This is an amazing that our stress response has a built-in mechanism for stress resilience, and that mechanism is the human connection. So let us make our connections more stronger, plan something for future, see what best can be done, and in that connection, we are only going to see the need assessment. What is the need assessment of our population who suffer in oncology? What is the need of the caregivers? And what is then our own need? So that self-care. Shad Salim Sahab, he had a mechanism in place where you didn't do anything. It was only automatically that got mobilized and everything was in place. So if he has so clearly described it for us, this should not be just Guptam, Nishastam and Barkhastam. Let us end it with this pledge that we will continue discussing this. Inshallah, if you agree, I had for today prepared something, but that was something which would be only bookish. After Professor Shad Sahib, what he said, it would not have been proper and appropriate to mention anything from the books. Thank you very much.